Healthcare is supposed to be the place where money matters less because health matters more. In real life, money often decides how quickly care appears. That is how healthcare becomes a wealth filter. It does not always say no, but it often sorts people by speed, price, paperwork, and options. The sorting can look polite while still being brutal. The strange part is that the filter can be invisible until you need it. When you are healthy, insurance looks like another monthly bill. When something goes wrong, it becomes the map of what kind of care you can actually reach. This video is not about saying doctors are villains. Most people inside healthcare are trying to help. The problem is the system around them: premiums, deductibles, networks, bills, coding, prior authorization, and private access. In that system, illness is not only medical. It becomes financial logistics, which is a strange thing to discover when your body is already under stress. And logistics favor people who have money, time, literacy, and someone to help them fight the paperwork. That is not medical skill, it is administrative privilege. That is the first uncomfortable truth. Healthcare access is not just about whether care exists. It is about whether you can reach it without being financially punished. Start with the price of being insured. KFF reported that employer-sponsored family health coverage reached nearly $27,000 in annual premiums in 2025. Workers paid thousands of dollars toward that coverage, even before anyone got sick. That is the funny thing about health insurance. You can pay a lot just to earn the right to pay more later. The system calls it coverage, but many families experience it as a subscription to uncertainty. The premium is only the entrance fee. The deductible is the second gate. KFF also reported an average deductible of nearly $1,900 for covered workers with a general annual deductible in 2025. For many families, that deductible is not a technical detail. It is the difference between go now and wait and hope. And waiting is often where health and money both get worse. This is where healthcare becomes behavioral. Prices do not just charge people, they change what people do. A wealthy person can treat symptoms early. A stretched household may wait until the problem becomes impossible to ignore, which is often the most expensive moment to act. The disease may be the same, the timeline is not. And in healthcare, timeline can become outcome. Earlier care is not just more comfortable. Sometimes it is the difference between simple treatment and a much harder road. Now look at the uninsured. Census data estimated that 27.1 million people, about 8% of the U.S. population, had no health insurance at any point during 2024. For those people, the filter is not subtle. The question is often not which doctor, but whether the bill is survivable. That is a terrifying way to make a health decision. And even insured people are not safe from the filter. KFF found that just under half of U.S. adults say healthcare costs are difficult to afford. That includes people with insurance, because insurance is not the same thing as affordability. This is one of the biggest misunderstandings in the whole system. Insurance coverage and actual affordable access are related, but they are not the same thing. Coverage can mean you are allowed into the building. Affordability decides whether you can stay there without financial damage. The second filter is networks. A plan might technically cover care, but only if the right doctor, clinic, hospital, lab, and pharmacy are inside the correct network. One wrong piece can turn a covered system into an expensive surprise. That creates a strange modern ritual. Before getting care, patients become amateur contract lawyers. You do not just need a doctor, you need to decode the rules around the doctor. Is this doctor in network? Is this lab covered? Is this specialist authorized? Will the bill surprise me later? People with money can often buy their way around the confusion. They can pay out of pocket, choose premium plans, use concierge medicine, or call someone who solves it for them. Ordinary people get a phone tree, a portal, and a warning that the answer may not be final. That is not just annoying. It is a form of rationing by exhaustion, where the system technically offers a path, but makes the path hard to walk. The third filter is time. Time is healthcare currency, and wealth buys more of it. A person with paid leave can schedule an appointment. A person without it may lose wages just to sit in a waiting room, which means the appointment has a hidden income cost. A person with a flexible job can get follow-up care. A person with a rigid schedule may disappear from the system after one visit. This is where health and work become tangled. The people whose bodies need rest the most are often the people whose jobs allow the least of it, and that is one of the cruelest parts of the wealth filter. Money does not just buy treatment, it buys recovery space. It buys the ability to heal without calculating every hour as lost income. The fourth filter is geography. Good healthcare is not evenly spread across the map. If you live near strong hospitals, specialist offices, and pharmacies, your health system feels closer. If you live far from care, the appointment starts before the appointment, with transportation, time off, gas, childcare, and planning. The medical visit becomes a whole logistical project. That means distance becomes part of the price. And distance hits differently depending on whether you have a reliable car, flexible work, and someone who can help. The fifth filter is complexity. The American healthcare system is not just expensive, it is complicated in a way that quietly rewards educated, organized, time-rich people, especially those who can keep calling until someone fixes the problem. Bills arrive with codes. Insurance explanations arrive in language nobody would use in normal life. You may not even know whether something is wrong, overcharged, duplicated, or simply mysterious. Confusion is not a small detail when confusion has a dollar amount attached. This is how complexity becomes a filter. People with resources challenge bills, call again, appeal denials, and ask better questions. People without resources may pay, delay, ignore, or give up because the fight costs energy they do not have. Sometimes the obstacle is not the bill alone. It is the battle around the bill. A system can be technically open and practically hostile. That is the kind of phrase that sounds dramatic until you try to solve a billing problem while sick. That is healthcare as a wealth filter in one sentence. The sixth filter is medical debt. Medical debt is strange because nobody goes to the hospital as a luxury shopper. You can make no irresponsible purchase and still leave with a financial wound. That is why medical debt feels different from a shopping mistake. That makes medical debt morally different from a lot of consumer debt. It often begins with pain, fear, accident, or diagnosis, not with a shopping cart. The credit reporting side has been changing too. The CFPB finalized a rule in early 2025 to remove medical bills from credit reports used by lenders, but that rule was later vacated by a federal court. That legal back and forth shows how unsettled this question still is. That tells you how contested medical debt has become as a financial signal. Even policymakers disagree about whether sickness should follow people into credit pricing. And honestly, that disagreement itself says something important. When illness can affect future access to loans or pricing, healthcare stops being only a health issue. It becomes a financial reputation issue too. It becomes part of the class system. Now, there are good sides to modern healthcare that should not be ignored. The technology is extraordinary. Many treatments that once sounded impossible are now routine. Emergency care saves lives. Specialists solve problems that would have ruined past generations. The system has brilliant people inside it. That is why criticism has to be precise. The issue is not that healthcare has no value. It has enormous value. The issue is that the most human version of healthcare often becomes easier to access as wealth rises. Better money buys a softer version of the same system. Fast appointments, clearer communication, better networks, private rooms, second opinions, less waiting, less fear of bills. That is not just better service, it is better odds. And when the stakes are health, better odds are one of the most valuable things money can buy. And better odds are a very serious luxury. This is where the healthcare wealth filter becomes almost invisible to people who benefit from it. If every appointment is available, every bill is manageable, and every specialist is reachable, the system feels normal. If every appointment requires negotiation, every bill is scary, and every specialist is out of reach, the system feels like a wall. You may technically have coverage and still feel locked out. Both people may say they have healthcare. They do not have the same healthcare experience. One has a system that responds, the other has a system that must be negotiated with. That difference is the story. So what can a regular person actually take from this? The answer is not to panic, but to understand the parts of the system that punish confusion. First, do not treat the insurance card as the whole plan. Know the deductible, out-of-pocket maximum, network rules, urgent care options, and prescription rules before the crisis if possible. Do the boring homework before fear is making the decisions. Boring knowledge becomes valuable when stress is high. Second, Ask for estimates and itemized bills when you can. You may not always get perfect clarity, but asking can still expose mistakes or options. The point is not to become an expert, it is to refuse being passive. Third, challenge bills that look wrong. Medical billing is complicated enough that errors and confusion are not rare. Fourth, do not ignore official assistance options. Hospitals, nonprofits, government programs, and insurers may have hardship processes, charity care, payment plans, or appeals. The problem is that people often hear about them only after damage is done. The painful truth is that the help is often hidden behind paperwork. Fifth, protect your time like part of your health. Time off, transport, follow-ups, and recovery are not side issues. They are part of care. If a problem is small now but getting worse, delaying care can become more expensive medically and financially. That does not mean panic over every symptom. It means do not let cost fear be the only doctor in the room. Sixth, if you have choices, choose plans and jobs with healthcare reality in mind, not just headline salary. A benefits package can quietly be worth more than it looks. A slightly higher paycheck can be weaker if the healthcare exposure is much worse. That is one of the most important practical lessons here. Healthcare is not a side benefit. It is part of your real income, your risk level, and your freedom. A job with bad coverage can be more expensive than it first looks. The bigger lesson is social. A society reveals its hierarchy not only by who has luxury goods, but by who can get care early, calmly, and without financial terror. That kind of calm is a real class signal. That is a sharper status symbol than a watch or a car. Because the highest form of status is not showing off. It is not having to panic when your body needs help. Calm access is a luxury people rarely call luxury. That is why healthcare became a wealth filter. Not because every doctor treats people differently on purpose, but because the system around care turns money into speed, clarity, choice, and recovery space. Those are not small advantages when your body is the thing at risk. And when health itself depends on those things, wealth becomes more than comfort. It becomes protection. That is the final truth. Healthcare is not only where inequality shows up. It is where inequality can become physical, because delayed care, stress, and financial fear eventually land in real bodies.